So tonight, lots of great questions, all pumping, breastfeeding related. I love these nights where I can just talk to you about my favorite topic, which is talking to you about how to successfully breastfeed your little ones. And that's what we're going to start doing right now. Let's move on to the first question, everybody. Okay, first question came in from Ashley. And Ashley said, she's got a pumping problem. When she first returned to work, she was always pumping more than her daughter ate, but now she's pumping less and less, even though she feels super full after a 20-minute pumping session. Used to get 2 to 3 letdowns each time, but now I've only been getting 1. Is it possible my body isn't responding to pumping anymore? At home, I nurse frequently on my days off to keep my supply up. Pumping is also becoming painful. I've tried changing my flange sizes and pumping lube, but nothing seems to be helping. I don't know what to do. Help. Okay, couple things. You mentioned here that you are using you changed your flanges. It could be that you're still not having the proper fit with your flange, and the reason I'm saying that is when the flange is not fitting properly, and this is a flange for any of the new mamas, and you guys always tell me I'm a brand new mama, I don't know much, so I'm not going to assume. Okay, the flange is the part that goes up against your breast. When the flange doesn't fit properly, you will feel pain, and so this is kind of giving me an indication that you may have the wrong size flange if you're feeling pain when you're pumping and all of a sudden it's become painful. Remember, the flange is the piece that goes up against your breast and your nipple goes inside this hole. And your breasts do change over time. So if it was fitting, it may not be fitting anymore. And that's why it's important. It's always one of the things I say to make sure that you have a pump that has multiple flange sizes included with the pump. Okay, this is the Even Flow Feeding. You guys know I love this pump. I helped design it. It comes with 3 different size flanges included, and this is one of the reasons why is that a few months into pumping, your breasts can change shape, your nipples can change, and you may need a different size. So that may be what's going on right here, and you may not have sized it properly. That's the first thing. The second thing is that you may be having problems with your suction. If you're not getting if you can feel that your breasts are still full and you're not emptying the breast, it could be a suction issue. So that could be one, either the pump is not working as it should, or 2, you may need to change your little spare parts. And when I say spare parts, I'm talking about the little valves and membranes. Sometimes they look like this. Sometimes they look more like, what do you call it? Like a valve, like a white valve that goes on, but they do wear out, and you do need to change them frequently, especially if you're working full-time and pumping several times a day. You may have to change them, as often as 1 to 2 every month or 2. Waiting too long to change them and you're not getting enough suction, that could be the reason. So I know you said you changed spare parts, but it may be that you're waiting too long to change them again. They do wear out. It's like a nipple on a bottle. It wears out over time. So I would try doing that. And the other thing too is that your body could be changing its response to the pump. What I would try is possibly focusing on one breast at a time and doing some breast compression while you're pumping. So when you put the pump up, you're going to kind of compress down on the breast tissue while you're pumping. Sometimes you need a little bit of extra like that, and compression is a great thing to try when you're trying to get more of the milk out. So those are some tips that I would offer you, Ashley. Hope that helps you. Okay. Yes, all right, so let's give the rules here. So when I do a question and we answer that question, we always give hearts, okay? Hearts for Ashley for asking the question, hearts for Shari for answering the question, hearts for all of you for being here to listen. So we always give hearts at the end of each question. So I want to see a bunch of hearts going across the screen. Okay, that is the rule. I know some of you are new. In fact, if you're new to the show tonight, I'd love for you to just tell me I'm new, because we love to welcome newbies to the show. We have new people joining every single week, and I'd love to see all of you, post right here so we can properly welcome you to our community, because this is an amazing community, which if you are new and this is your first stream, you're going to see that here just in the amazing comments and support that not only will I give you, but everybody here in the community will. So look at all those amazing hearts. Thank you. Okay. Next question came from Susan, and she said, "Hi, Shari. My 6-week-old son is exclusively breastfeeding and a pretty good eater, but sometimes he strains really hard. He turns red and starts to twist and squirm. He will push off with his hands and kick his feet, all while staying latched to me, so it hurts me." Yeah, do you know that feeling when the baby's taking the nipple with them? Know that feeling. So when he does this, I use my pinky to break the latch and sit him up and try again. But he seems so uncomfortable that I wonder what's bothering him. I've asked my pediatrician and the nurse practitioner in his office. They say it's probably just gas, but there doesn't seem to be a solution. Is this common? And will he grow out of it? So I'm going to answer this question the way I always do when it comes up. Is, sometimes, not sometimes, but breastfed babies need to burp. Okay, and it is a huge myth that is out there that somehow when you're breastfeeding there's no air in the boob and so the baby doesn't need to burp, but that is completely wrong. Everybody who swallows air, and so breastfed babies do need to burp. And everything you're describing right here to me, that whole behavior of squirming and twisting and turning red and looking uncomfortable, all of that to me is screaming, I need to burp, okay? And babies do tell you when they need to burp. I just answered this question for somebody on my page about this because oh no, it was actually somebody had left a question on my burping video. And if you haven't seen my burping video, make sure that you go look for that on my Facebook wall. There's a really good video that explains my burping method. I'm not on Blue Jeans tonight, so I can't play it tonight for you, but you can go ahead and maybe Joe can find the link and post it for all of you if you haven't seen it. But it's my method of burping. And what I always explain is that you need to watch the baby. It's not a timing thing. It's not like after such and such minutes the baby needs to burp, or after you feed on one side then they burp and then you feed the other side. That could be so, but you also need to watch your baby because your baby's going to give you cues that the baby needs to burp. And what it looks like is the baby's eating, baby's nice and still, they get really into the feeding, they're nice and relaxed, they're not moving their whole body around, but they're focused and they're eating. And then all of a sudden, the baby arches their back, or they pull back, or they squirm, and they start to wiggle, or they're grunting, or there's something's happening. And what just happened is the baby swallowed a big air bubble, and that feeling of that air going down and that need to burp it up will cause the baby to look uncomfortable. And you need to take that as a sign that, oh, it's time to take the baby off and burp. And if you've got a heavy letdown, your baby may be swallowing a lot of air, which means the baby needs to come off the breast frequently and burp, all right, in between. So that's just the first thing I thought of when I read your question, Susan, was that I would make sure that I'm burping. You may need to burp 5-6 times during the feeding. And using my method will definitely help, okay? Because the baby needs to be awake and not crying in order to burp. And I'll show you how to do that in my video, okay? All right, hearts for Susan. Thank you for your question, Susan. Hearts for Susan. Let's move on. And the next question, I'm going to keep going because you don't even understand. I've got like 5 pages of questions here, and I know you want to hear the answers. So, the next question came in from Erin, okay? And Erin asked the question, this is about her, it's a milk supply question, she said. Yes, thank you for the hearts. I know there is a risk of your supply dropping from exercise. Is this because of the calorie loss? So you just need to make sure you eat enough, or is it a water issue or something different? We did 2 major hikes last weekend in the heat, and I noticed the baby getting frustrated when nursing. I have a feeling my supply went down, and now I want to know what I can do differently next time. Just from this particular question, what I would say is that it's more likely was a dehydration issue. I would say if you're hiking in the heat, if you didn't drink enough water, you will notice that you could have a decrease in your supply. That being said, drinking, so this is how it works. Not drinking enough and dehydrating can definitely decrease your supply, but Drinking a lot more will not necessarily increase your supply and can actually have the opposite effect. So you want to make sure that you're drinking enough, drinking to thirst, making sure that your body is hydrated. The best way to tell is to make sure you're not thirsty, and also to look at your urine. If your urine is a nice pale yellow, it's not concentrated, you're not feeling thirsty or dry, then you're hydrated. A lot of people will think that if they want to increase their supply, they need to guzzle, guzzle, guzzle and drink, extra water, forcing fluids. That is not a good idea, okay? But in this case, if you're in the heat, if you're doing a lot of exercise, if you are losing a lot of fluids from that, especially now in the summer months, you need to make sure that you're staying hydrated, because that dehydration can definitely decrease your supply. And I have a feeling that may have been the case. Also, if you did 2 major hikes, were you nursing the baby? Were you taking breaks? Did you skip feedings? If you were skipping feedings during those major hikes, or prolonging feedings, that can quickly start to decrease your supply too. So it could be a combination of the two. Excessive exercise could have an impact, but usually not as much as the dehydration. So I'm more concerned with the fact that you didn't get enough water or you overheated. Okay. So she also had one more question that I'm going to answer as well. She said, could caffeine be affecting his sleep? I've always had a cup of coffee in the morning, but I've been having a second cup in the afternoon because I've been so tired. He's been sleeping horribly. This has been going on for about 2 weeks. Yesterday was the first day I didn't have a cup in the afternoon, and he had a great night's sleep, only waking up once, wondering if it's a coincidence or not. First thought, not a coincidence, okay? So caffeine, is it okay to drink caffeine while you're breastfeeding? It is okay to drink caffeine while you're breastfeeding, unless your baby's not sleeping. So in this particular case, when you're asking me, I'm drinking the 1 cup in the morning, seems like it was fine, added that second cup in the afternoon, baby's not sleeping good, as soon as I stopped drinking it, baby started sleeping again. That's a sign. It's not a coincidence. And so my answer to all of you with caffeine is watch your children, watch your baby. If the baby is reacting, if the baby's not sleeping well, because you may need to cut back. It may be too much caffeine. It does go through. So you want to pay attention to the baby and respond accordingly. Okay, so let's get some hearts for Erin for her 2 wonderful questions. Let's get some hearts for Erin. And coming across the screen there, I want to see lots of love, lots of love. Okay, speaking of love, let's talk about the prizes here for a moment, okay? First of all, I want to talk about Lacta Lite, all right? For those of you guys who don't know, and actually, this next question, let's do this for a second, because Rachel on this next question actually said, I ordered a Lacta Lite and I've been loving it. Total nighttime pumping game changer. So I want to show you what that means, because what is she talking about? Nighttime pumping, all right? Well, here's what it is. It's a little light. This is such a genius thing, okay? It's a little light, and I don't know if you could see the light going on. It's got blue light and white light, okay? And what it does is you put it right onto your breast pump flange like that. And at night, when you want to pump, it lights up the nipple tunnel, okay, this tunnel part here, so that you can see that your nipple is placed properly within the flange, and you can also see when the milk is flowing. And so many of you guys tell me, oh my gosh, I've been using my cell phone at night. I don't want to wake up the baby. I don't want to wake up my husband. I don't want to wake myself up by turning on all the lights. But it's really hard to pump in the dark. And so Kelly and Patrick invented the Lacta Lights, and they are just an amazing product that's helped so many people. I mean, so many of our viewers have used these Lacta Lights. If you have a Lacta Light and you're using it, go ahead and post here, because I know that they got some big fans of this product, okay? So it works on pretty much every breast pump. It's a tiny little light like this, very simple. You just pop it on, and now in the dark, you can actually see. And that's important, because if your nipple's not lined up properly, it's going to make it difficult to get your milk out. So it not only does it make it more convenient, but it has an impact on your supply. If your nipple's not properly positioned, it's not going to pump the milk out. If you are not, you want to see when you're stimulating that letdown. You want to see when you need to, move the controls on your pump, like I talk about in my 3-stage pumping method, where you're adjusting your settings so that you are getting your second letdown, your third letdown. So the Lite will actually help you to pump more efficiently, and when you're pumping more efficiently and you're getting more milk out, then you are going to keep on producing enough. So everything kind of links up with each other. And so these products sometimes are convenient, yes, but they're more than convenient, they're functional. And that's what I love about the Lacta Lite. And speaking of functional too, let's talk about Rachel's Remedy as well, because that's our other sponsor tonight. Okay, Rachel's Remedy are these amazing relief packs for your breast. And if any of you guys have used the Rachel's Remedy, I want you to go ahead and post right here. It is wonderful. This is just, again, another I have the best partners, okay? They make the best products. What this is, it's a hot cold pack. So there's like a little sack inside here. It's got flaxseed in it. Okay, it's all natural. This goes inside this waterproof case, okay? And you can stick this inside the microwave or the freezer, so you can make it hot or cold. And then it's got this piece on the front that can be moistened, all right? And the moistened part goes right up against here and stays on there, so that you can then take this whole thing and put it inside your bra. So you have moist heat up against the breast. And moist heat is amazing for helping with plugged ducts, with mastitis, for helping the milk to flow. So right before a pumping session or a breastfeeding session, to be able to go ahead and put this right inside your bra to create that moist heat. Moist heat will actually penetrate the skin way better than dry heat, and that's why the moisture is important. And up until we had Rachel's Remedies, what you do is you have these wet washcloths and you're soaking wet. It's just not. You can do it, but it's a mess, and it's hard to keep them in there and keep your clothes dry at the same time. So these are a fantastic invention. Thank you, Rachel, okay, for Rachel's Remedy. And if you do have plugged ducts or mastitis, if you're somebody with recurrent plugged ducts, then this is definitely the product for you. Definitely the product for you. Joey's posting, there he is. He's posting the links to Rachel's Remedy and Lacta Lites in there. You can go ahead if you want one of those. Yes, they are so soothing and useful. Yes, I agree 100%, Rachel. Okay, so we're going to give away prizes tonight. Make sure that you like or love this post and that you are commenting here telling me what you love about both of those fabulous products. And let's move on to the next question. This one came from Rachel. No relation, but her name is Rachel. She says, I can tell when I'm really full, but I can never tell when I'm empty. How long should I continue pumping with no letdown before I call it quits? I'm struggling with a baby. She's not showing a lot of issues, but just spitting up. She doesn't think it's reflux related. And borderline low supply. The pediatrician isn't recommending supplementing yet because she's hitting her milestones. But I want to encourage more production. And that's when she said she ordered the Lacta Lites and she's been loving it. This is the first thought that came to my mind when I read your question, Rachel, was there's something going on here. There's just something going on here. The fact that the baby is struggling with, spitting up, but then there's also a slow weight gain, and then you're also dealing with borderline low supply. I don't know how old your baby is, but I would really think about the show that we had last week, thinking about tongue ties and lip ties, and the idea that when a baby may have a structural issue in the mouth, whether it could be a tongue tie or a lip tie or both, what you will see is that the baby sometimes swallows a lot of air, and those babies do spit up a lot, not from reflux, but just from swallowing so much air, which can affect their weight gain, which can also affect your milk supply. So if the baby's not latching well to the breast because of that tongue tie, it could be that your supply will start to decrease. So sometimes we're looking in one direction where we're trying to say, okay, I'm not pumping enough. What exactly is happening? When nobody's actually looked inside the baby's mouth. And so I don't know, when I'm reading your question, my first thought is to please have them look inside the baby's mouth, because if you're already talking about supplementation and possibly low milk supply, you need to find the underlying cause, and that could be it. It sounds like you're nursing frequently, so something else is happening, and that's going to be my answer to you. Okay, that something else is happening. Get the baby checked out and go to a lactation consultant, because we talked about this last week, that not all the pediatricians are really knowledgeable about evaluating these tongue and lip ties or these tethered oral tissues in the mouth. Watch the live stream we did with Dr. Scott last week, and then go to a lactation consultant who could really help you to look at what's going on with that latch. Is the baby functioning properly? Is something else going on? Okay. Let's get big hearts for Rachel. Thank you for your question, Rachel. And what's going on here in the chat room? I'm talking so much, I'm like, okay. Everybody's posting about the Rachel's remedies and about the lactolates. Okay, awesome. Keep on going here and let's get some hearts. Yay. Okay, next question. First of all, let me take a drink. And this is not wine, okay? I just like to drink it in a fancy glass. But this is watermelon tonight, watermelon drink. If I drank wine, we would have a problem because I wouldn't be able to answer your question. So I'm going to take a sip. Okay, let's move on. Next question. Next question. If you see me looking over here, it's because I'm trying to read your questions because I want to be part of the party here. All right. Next question came from Tanya. Tanya said, I'm 30 weeks pregnant with baby number 2. I wasn't able to breastfeed with my first, but I'm going to this time. Excellent, Tanya. Why do women get blisters and other issues while they're breastfeeding, on their breast while breastfeeding? I always thought it was because of them not keeping it clean before and after feeding. Like I said, never breastfed before, so no judgment. Never judgment here, Tanya. Always ask your questions and never feel concerned about anything you ask. But let's clear up this myth, okay, or this misunderstanding about what causes this. So you do not need to clean your breasts, all right? So the blisters, or if you're talking about like cracks or blisters or bleeding nipples, those kind of things do not happen from having a dirty breast, okay? It's not that you need to clean. And in fact, cleaning the breast is actually wiping away the natural oils that are on the breast that keep the breast, the milk itself is antibacterial. There is no reason to wash your breast and it will dry it out. So there's no reason to wash. What typically causes what I think you're referring to, which is cracked nipples, sore nipples, or blisters, is an improper latch. That's usually the reason, is a poor latch, is for whatever reason. It could be many different reasons that the baby could be latching improperly. It could be your positioning. It could be the way that you're holding the baby to the breast. It could be the baby's oral structures like we just talked about. It could be you not holding the baby close enough. So there's lots of reasons why the baby would have a poor latch, but that's the main cause of nipple pain and soreness, all right? And not cleaning before and after feeding, because you're not actually going to be doing that. Okay? Good question, though. Good question. I'm sure you're not the only one who was wondering about that. So let's get some hearts for Tanya, and congratulations on baby number 2 coming in a few weeks. All right? Hearts for Tanya. I am flying through these questions. You know, usually I get so hung up on these questions, I will talk forever, and then I never get to the end. So tonight I am answering them short and sweet, but great information. If you guys like what you're hearing, I would love to get some hearts and some love. Are you learning something tonight? Because I want to make sure everyone is learning along with us. Yes, learning something. Okay. Linda asked a question. All right, here's Linda's question. Are there any particular brands of lanolin that you would avoid or recommend. I read that there are some that have to be removed before breastfeeding because they aren't safe for babies to ingest. Also, are there any foods that you should be avoiding while breastfeeding? All right, so two-part question here from Linda, all right? First of all, I think you're using the word lanolin to describe all nipple creams, okay? And not all nipple creams have lanolin in them. And as a matter of fact, I don't recommend lanolin at all. So I recommend nipple creams that have zero lanolin. And there are many on the market. The one that I really, really love is made by a company called Earth Mama Angel Baby, and it's nipple butter. It's organic nipple butter. So I don't recommend lanolin. I don't feel like it really works to heal any kind of sore nipples. It does not have any healing properties to it. It's very thick and sticky. And also, I don't like how they make lanolin, which comes off the skin of a sheep, okay? So for all kinds of reasons that we're not going to get into, I avoid lanolin altogether. So any nipple creams that have a lanolin as an ingredient, I don't use it. The ones that I use are organic. The ones that I use have usually an olive oil or coconut oil base. They have calendula in it as an herb that's really healing to the skin and to the nipple. And those are the ones and the only ones that I would recommend to you. Okay, so that's first of all. And yes, those are safe to ingest. So especially the Earth Mama, that one for sure, totally safe to ingest. It's a good question, Linda, because you're putting this on your nipple and then you're putting your baby on the breast, and so anything that you put on your breast is actually going to, first of all, absorb into your skin, but also go into your baby's mouth. They're basically eating it. So most of it will come off on the nipple pad, but you're still putting into the baby's mouth, on the breast pad, but you're still putting your baby's mouth on it. So I prefer something organic and edible, okay? And nipple butter is one of those things. Second part of your question, are there any foods that you should be avoiding while breastfeeding? The general answer to that question is no, not really. I don't really recommend avoiding much of anything while you're breastfeeding. And the reason is because most babies can tolerate all kinds of foods. And so these thoughts of like, I shouldn't eat spicy food. I think I actually just posted this a couple days ago about the flavorful foods, spicy foods are all really good for your baby while they're developing their taste buds. We should be introducing that. Not eating bland foods, not avoiding all kinds of spices. It's really untrue that, foods, there are certain foods that you're going to eat and that are going to just disagree with your baby in general. Now, are there individual circumstances? Absolutely. There may be circumstances where your baby may be reacting to something, but I would not just off the bat avoid that. If you're going to eliminate something, the one thing that I would try and start with is cow's milk, because if baby's going to react to anything, the majority of them will not tolerate the cow's milk that will go through, that protein from cow's milk that human babies are just not meant to have. And actually humans in general weren't supposed to drink cow's milk. So a lot of us can't tolerate it, and even if we can, it's probably not that good. It's really not that good for you. Cow's milk's really not that good for you. And we're going to do a whole show. I'm thinking July, because we've been talking about this a lot. Like, it comes up often in many different episodes. And I think I'm going to have Dr. Susan come on, and we're going to talk about cow's milk and human consumption and what about it is not good for you. It's very inflammatory to the body. Human babies do have a really hard time digesting cow's milk. And so when you're looking at any of the parts of your diet that you're thinking, my baby's really gassy, my baby's really uncomfortable, my baby's just not responding to something well, the first place to look, in my opinion, is any of the dairy that you might be eating. And that could be milk you're drinking, it could be ice cream, it could be cheese. All babies are different, and a lot of them are really intolerant to cow's milk. Both of my kids had dairy intolerance, which means that I could not have any dairy at all when I was breastfeeding. Any dairy at all, that protein would go through into my milk, and they would be a disaster. I mean, a disaster. All night, they would cry all night, and it happened pretty quickly. It's only a few hours from when you eat the dairy to you're going to see the result in your baby if your baby's responding to that. But if you're going to try to cut it out, it could take weeks to come out of your body. So, don't just cut it out for a day and say, oh, it wasn't that. You have to give it a couple weeks to really take all of it out, and you've got to read labels because there is hidden casein and dairy in a lot of foods that you would not expect, okay? Yes, let's see. So, Linda's on here. I'm answering her question, and she's on here. Excellent. Yay. Okay. You're having your baby in the next couple of days, and these are some of the things you're curious about. So excited. Congratulations. Let's all congratulate Linda here. She's about to give birth, and she's getting her questions answered in the nick of time. But you're in such a great place, Linda, because you have such an amazing community of mamas here that will be able to support you, and of course I will support you, and we're all wishing you a lot of love on the arrival of your little one. This is your first baby, I know that. So, mwah, Linda, we're so excited for you guys. Okay. Let us move on to the next question. I'm so curious about what you're writing here, so I'm going to take a look. Okay, excellent. All right, talking about foods, yay. Okay, next question came in from Alina Chavez. Alina said, I missed the last one, I'm assuming my last live stream, and she said, but I'm wondering how many times I need to pump and for how long once my little one starts solids in a month. He nurses on demand. Okay. Well, sometimes the questions that you guys ask are not actually the questions you need to hear. So in this particular one, I'm going to say, you're wondering how many times you need to pump and for how long once your baby starts solids. If you're with your baby, and I'm assuming you're not absent from the way you asked your question, I'm assuming you're there, the baby's just starting solid foods. When you start solid foods, you're not going to give only solid foods and eliminate or pump during that feeding. What you want to do is you want to offer your breast milk, so you're going to breastfeed the baby before you offer the solids, okay? So there really is no reason to pump unless you're skipping the feeding altogether, which doesn't really make sense. So what I would say is if you're going to start solid foods, which should be after 6 months with a breastfed baby, and that doesn't have to be at 6 months, but after 6 months, okay? When you do that, what you want to do is you always want to offer the breast first to the baby. That way the baby's getting the breast milk, which is where the baby's getting the majority of their nutrition for that whole first year. So you're offering the breast, and then you're using solids as a complement to the breast milk, okay? So it's complementary to the breast milk. It's not instead of. And so you really don't need to pump if you're breastfeeding right before, okay? So that's going to be the way to do it. We just did a whole show. I had Dawn Winkleman on with me. She's a feeding specialist. You guys all know Ms. Dawn. And so she was on. We had a really great show just a couple weeks ago on starting solids with your baby. If you missed that show, please go back and watch it. It was really, really good. And we talked all about what solids to start with, how to introduce solids, and then also how to incorporate breastfeeding with the start of solids. And that was a big part of our conversation. So you can go back and watch that episode if you're at the point after 6 months to start solid foods, because there's a lot to know. Okay, hearts for Lena. Hearts for Lena. Let's get some hearts going across the screen. Thank you for your question. Good question. Are you guys all posting about the prizes so that you are eligible to win the prizes tonight? Yeah, I see you're kind of quiet. Are you all listening to me? Is that what's going on here? When I talk a lot, it always gets so quiet in the chat room. I think you're all listening. All right, let's move on. I still have a few pages left to go. Next question came from Maria, okay? And Maria said, my son will be a month old. He's not latching on. When he was born, he did good latching on, and then I made a big mistake of giving him a bottle, and he's not latched on more than 5 times for a short period. Should I lose hope that maybe one day he will latch on? Right now I'm having to pump and feed him a bottle, which is frustrating Because I feel like my supply is low. It was good for the first week or so, but it's changing. Okay. So let's talk about this for a minute, because this is the pros and cons of introducing the bottle. If you introduce the bottle too soon, and if you do offer the bottle too much in the beginning, the baby can develop a preference for the nipple on the bottle or the bottle feeding, because it's less work for them. They don't have to work as hard. And so that can really interfere with your nursing relationship if you're doing too many full bottle feedings, which I don't recommend at all, till at least after 6 weeks. Okay. That being said, I don't recommend waiting till 4 to 6 weeks to introduce a bottle. So it's somewhere in the middle. It's a happy medium. And for those of you guys who've taken my Simply Breastfeeding class, you know that I highly encourage moms to introduce their babies to a bottle early on, within the first 1 to 2 weeks, if the baby's latching well. But there's a very specific way to do it to avoid exactly what Maria is experiencing here, which is the baby rejecting the breast and then going to the bottle, which we don't want to do at all. So if you watch my class, it will talk about, there's a whole chapter on how to introduce your breastfed baby to a bottle, which talks about how to introduce just very small amounts, like half an ounce once a day, to get the baby used to the bottle, but also finishing at the breast to continue taking the breast. And so the best way to prevent this breast rejection is to introduce the bottle appropriately and not too much. Avoid pacifier use. If the baby is having any kind of struggling with the breast, you never want to use the pacifier instead of breastfeeding, especially in the beginning. Although you can use some pacifiers, and at the same time introduce that baby to the bottle so they don't reject the bottle, so that when you go back to work you're not going to have an issue. All right, so it's a happy medium. For Maria and her situation right now, I would definitely not lose hope, okay? But you have to start working at getting the baby back to breast. The more bottles, the baby's just going to not go back. So a couple things I would recommend is, one, start doing more skin to skin with your baby. Okay, so take your top off, take the baby's clothes off. I'm talking skin to skin, because the more skin to skin the baby does, the more that will encourage the baby to latch to the breast. All right, that's one of the best ways to get a baby to get their innate reflexes and their innate behaviors that are wired to breastfeed. It will trigger that by putting your baby skin to skin. We're going to be doing a whole episode. Super excited. You guys are the first to hear about this. Just confirming it today, and I was just emailing back and forth confirming it today, but I have someone amazing coming on to have a whole conversation just about skin to skin. We're going to be doing it in July. She's also a certified nurse midwife and an IBCLC, and I'm just excited to have someone with the same credentials as mine, which I never see that, to come on with me and talk about the importance of skin to skin and all the benefits. We're going to be doing that in July, so make sure that you look out for that announcement and join us for that show. But skin to skin is probably one of the best things that you could do to encourage your baby to latch back to the breast. All right. The other thing is to keep putting the baby on the breast. Keep offering the breast to the baby. Start the feedings by offering the breast to the baby. Maybe when the baby's super hungry, you can give a little bit of breast milk, or you can give a little bit of milk from the bottle if you want to, but I would start at the breast, get the baby used to it, and if you feel like you're really not getting anywhere, then don't waste time. Make an appointment with a lactation consultant right away and have them help you to get relatched, because although pumping and bottle feeding will give your baby breast milk, it is not easy, and you can take it from a lot of the moms who do exclusively pump. They do it, and I have so much respect for moms who exclusively pump throughout the year, because it is probably the hardest of all choices, is to pump and breast and feed. And I understand why you do it, and I would do it too if my baby didn't latch, but I would try to get the baby back to the breast if possible. Okay, it'll make life a lot easier for you and enjoyable. Okay, so that's my answer to you. I hope it works out for you. Let's give some hearts to Maria. I know she's struggling. So lots of hearts and love to Maria. Joe's posting my classes up here. So if you guys don't know that I teach classes online, these are breastfeeding and pumping classes for any of you guys who have are looking to learn about, like, if you're expecting or someone who's expecting, please click on the link here. Go to my website, sharicriso.com. I have a class called Simply Breastfeeding that is just really important to watch before you actually go into the hospital, before you have your baby. If anybody's seen any of my classes and you want to post here and just tell them that if you loved it, if you got something out of it, if it helped you to breastfeed, I know you're there because I get messages from you every day telling me that it's helped you to breastfeed. Go ahead and post it right now. And there's also one called Breast Pumps and Briefcases, which is all about pumping, all about going back to work. How much do you need to leave? How much for your first day back? All kinds of tips about your pump and about making pumping work and working full time. Really good class. And if you purchase any of the Even Flow feeding breast pumps, you'll get the class for free. So whether you get the double pump or the single electric or the manual pump, you get Simply Breastfeeding. And when you get the double electric, you also get the breast pumps and briefcases. This is the Even Flow feeding double electric pump. This is the pump that I helped to design, that includes my classes for free, and that I absolutely love and recommend, and you guys know that. So that's the pump. Yes, you have both. Hi, Kate. Okay, so let's move on to another question here. Question came in from Corey. She said, I started back to work 2 weeks ago. I take 3 pumping breaks and only get 2 ounces each time. How do I get more? I'm quickly going through my freezer stash since I'm not getting enough during the day. Okay, I guess my thought was, when I read this question, was how far apart are your pumping sessions? You're pumping 3 times, and that means that you may be pumping every 2 hours. And let's talk about what are the normal amounts that you would expect to get out when you're pumping. How much does your body actually produce? How much does your baby actually eat? Because it answers the question of, like, how much should I be leaving for my baby? How much should they be eating while I'm gone? And is this a normal amount? And usually I say, a good baseline to go by to know how much you should be getting out is about 1 to 1.25 ounces per hour. And so if you're pumping every 2 hours, and you're getting 2 ounces, that may be actually a normal amount for you to pump, and you may not be able to get a lot more. Ways to increase that would be the hand compression, like I was talking about, using the dials on your pump, having a pump that controls suction and speed separately so you can stimulate extra letdowns, multiple letdowns, but also have a realistic expectation of how much milk your body is actually going to produce. And it may only be 1 ounce an hour. So if you're pumping every 2 hours and you're getting 2 ounces, that may be what you're doing. And it may be actually what your baby eats when you're home with them. You just can't see it. You can't measure it. And if your baby's going through a lot more than what you're able to pump, a couple things to keep in mind. One is, whoever's taking care of your baby and bottle feeding, are they pacing the feedings? And that means to slow down the feedings. Make sure they're not just pouring it down the baby's mouth. I'm going to talk a lot more about paced feedings. I think I'm going to do a video on it because we need to talk about what are the different things what are the different ways to pace a feeding. The way the baby needs to sit up, the way that the nipple needs to be in the baby's mouth, the way that you need to stop the baby and do frequent burping and let the baby control the feeding speed the way they would at the breast, which you don't want to just keep pouring it down their throat. Sometimes babies are overfed when they're fed with the bottle, and this can lead to you thinking that you are not making enough when actually you're making it just enough. It's fine, but they're feeding the baby way too much at one time. So that could be the case. The other thing, and I talk about this in my breast pumps and briefcases class, is that you may need to catch up on some of these pumping sessions at different other times. Like you may need to feed the baby one more last time just as you're about to drop the baby off at daycare. Maybe you fed in the morning and now you're dropping off the baby and you don't feed right before you leave. That may be a good time to just stop, sit down with the baby, feed for 5 minutes. You get a whole feeding done in 5 to 8, 10 minutes. and then you go off to work, and that gives that baby just that little bit of extra. Same when you pick the baby up, maybe a good time to just sit down and feed one more time, or if the baby's sleeping during the night, to get up once during the night and do a little extra pumping to make up for the difference that you may need during the day. And I talk all about this in my class, but the first and foremost is to make sure that you're aware of normal amounts of pumping and that the baby's not being overfed. There you go. Okay. Hearts for Corey. Let's get some hearts going across the screen for Corey. And I'm going to take a sip of my watermelon drink and keep talking. Okay. You guys with me here? You guys are all with me? I see the diehards are still here in the room with me. All right. Yay. Yes, and Rachel's saying, use the Rachel's remedy for 20 minutes before each pumping session. Thank you, Rachel. There we're back. Okay. I noticed it only does that when I'm going directly into Facebook like I am tonight. Never had that issue when I'm on Blue Jeans, so there you go. Yeah. Rachel's remedy, the moist heat, will increase milk flow, okay? Will help the milk to flow and let down. It helps oxytocin release, and so it is going to help your milk to flow and ultimately get more milk out. So great there. Thank you, Rachel, for that. You're absolutely right. Rachel's remedy is a perfect product for what you're doing there, for anyone who's pumping or breastfeeding. Okay, next question came in from Nicole, and Nicole said she delivered her daughter at 34 weeks. She's in the NICU. She's now 35 weeks and 3 days. My problem is that I'm pumping every 2 to 3 hours, but I'm only getting 1 ounce total per pumping. Am I doing something wrong? How do I up my supply? Okay, Nicole, so hard when you're separated from the baby and you're needing to pump around the clock and you know, trying to keep up with that amount. I would say that make sure that you're pumping frequently enough. It sounds like every 2 to 3 hours is good, but I would also make sure that you're using a good pump. Okay, I don't know what pump you're using, but some pumps, even some of the what they consider hospital grade, which is a whole other story, what that means, some of those pumps don't allow you to customize your controls as much as you need to. And what will happen is that when you're not customizing the way that you should, you may not be able to be stimulating the multiple letdowns that will help to drain the breast better. You get that one letdown, you push the button, it does that, you know, letdown mode, and then you're not really able to maneuver it to stimulate the second letdown and the third letdown. And if you haven't watched my my video on the 3-stage pumping method where I talk about how to use the separate speed and suction controls, it's so important. And I've had people who said, I was using that hospital pump, you know, the rental pumps that, you know, cost $1,200, and it doesn't have the same features on it like what you were describing. When I switched to one that did have that individual speed and suction control, I'm getting twice as much milk out. And you guys have seen some of the pictures that I posted that moms are sending me with all the milk that they're getting when they, just after the first time of using my method, is they're actually getting a lot more milk. And so you may be doing that, but I just want to really encourage you, because this is, when I designed, or I started to talk about the 3-stage pumping method, where did that come from? It really came from watching what a baby does. I didn't invent that. The babies invented that. What we did is, you know, what I did was take what the baby does and try to simulate what a baby does at the breast. That's all that's really happening. If you watch your babies, they know what to do. You don't know what they're doing. They're just doing it because they know how to do it, but they're actually stimulating second letdowns, third letdowns, and draining the breast. You'll see that the baby all of a sudden will start to suck faster and do it multiple times and then start gulping again. That's the multiple letdowns. So I really encourage you, make sure your flange fit is good. Make sure that you have a pump that you can control yourself. That's 2 separate speed and suction dials. And then watch my 3-stage pumping method. Make sure that you know how to use that pump. It's not enough to just turn it on. You can't, pumps are not, you don't just put it on and turn it all the way up, okay? And there really is a way to use your pump to make sure that it's effective for you. And speak to a lactation consultant. Your baby's in the NICU. There should be somebody there that can help you to make sure that you're doing what you need to be doing to keep your milk supply going. It's really hard. And make sure you're waking up during the night to pump. I know it's hard to do that. You're exhausted. And the thing about the pump is that it doesn't cry. So it's easy to skip those middle of the night feedings, but it's super, super important, especially for you, to be waking up during the night to continue pumping, because your prolactin levels are highest during the night, and it will affect your supply overall by skipping those nighttime feedings. You don't want to do that. Nighttime feedings are very, very important. Okay. So Rachel said here, yes, the method basically doubled my output. Amazing. Awesome. I love to hear that. If you guys are getting good results with this method, I want to hear it because it makes me so happy. I mean, this is the reason that I do what I do, is to try to make your lives easier, to help you reach your breastfeeding goals. And if something that I put that, you know, if this video is helping you, I love to hear it. It makes my day. Just think of poor me sitting here in my house where I don't get to talk to you, okay? I think it's working, but I want to hear from you. So it's very nice to hear your feedback. Always give me your good feedback. Give me all your feedback. I don't care if it's good or bad. Whatever it is, I'll take it. I just want to hear from you. So keep sending your beautiful messages to me. It makes my day. It makes me super, super happy. Okay. Let's see here. Amber, I always nurse before I pump. 2 minutes into a 20-minute pumping session, one stops and is empty. Is it okay to leave it pumping, or should I take it off and just pump one side? Okay, well, Amber, first of all, pumping after nursing is very hard. You know, the baby drains the breast a lot, and so pumping after nursing is not easy. And so in 2 minutes into a 20-minute pumping session, one stops and is empty, because your breasts are not symmetrical and your breasts do not produce at the same amount. So it could be that the baby ate a lot more from one side than the other, or one breast is making a lot more than the other side. And so it is completely normal that after a feeding especially, you may have less of an output from one breast than the other breast. It's also completely normal that if you're exclusively pumping, you'll see that one breast may be making double as the other side. There's not much you can do about that usually, because it has to do with breast capacity, and like I said, your body is not symmetrical. So excellent. Okay, hearts for Amber. Hearts for Amber. Should we keep going? Should we keep going and answer? I'm not even almost close. We're gonna have to do another session. What should we do? All right, let's do a couple more questions here. All right, this is a good question. Iron supplementation. I know that you guys want to know about this one. This came from Lorelei. Lorelei said, does a 6-month-old breastfed baby need vitamins or iron? Does our breast milk lack of iron? Oh, such a good question. Okay, let's talk about iron and breastfed babies. So many people are recommended by their pediatricians and from everyone they know that the baby needs to be supplemented with vitamins or iron, which is absolutely not true if you are exclusively breastfeeding your baby. This came about from formula-fed infants, and also the fact that breast milk does have less iron in it than formula, okay? But the iron is much better absorbed by the baby than any other iron. And in fact, giving iron supplements, when the baby's in utero and the baby is attached to the umbilical cord, the baby is getting all the iron that they need for that first 6 months of life right from you, okay? And what's also coming through the breast milk is enough to sustain them completely. I get asked the question, well, does it hurt to give more iron? You know, what if I do give more iron? It actually does, okay? And so when you are breastfeeding exclusively and your baby's getting what they need, when you give extra iron, so you give iron supplements to the baby, you're actually competing for the iron that the baby is naturally getting through the breast milk, and it can wreak havoc. Okay, so the iron that's in the breast milk, and there's proteins in the breast milk that bind to that iron, is only available to the baby for baby's use, not to the bacteria that also feeds off of iron. But when you give extra iron, now you've actually competed for that good iron, and you can actually cause anemia. All right, so it can have a negative effect. So breastfed babies do not need extra iron supplementation. And some of the studies actually say at least till 6 months, but sometimes 6 to 9 months, they don't need any extra iron. Once they start to eat solid foods, you can start to complement their diet, remember, in addition to their breast milk, some iron-rich foods. That does not need to be cereal. We talked about, rice cereal and all those other things. That's not necessary. You can start giving foods, that are higher in iron. And that will help to supplement your baby for what the baby needs. Now, if the baby is low in iron, you want to also test to see if there's anemia. That means getting a hemoglobin test to make sure that the baby is fine, because lots of times their iron can be low and they're still not anemic, and then you really don't want to do anything about it. So that was a long answer to the question, which is, if your baby is 6 months old and breastfed, do they need iron? And the answer is no, they do not need iron. Okay. And does the iron, Pat's saying, doesn't all the iron cause constipation? Yes, the iron can cause constipation, not to mention the fact that if you're taking a lot of extra iron during while you're breastfeeding, that can cause constipation in the baby. Once the baby does start to eat solids and you're giving them some iron-rich food, also make sure you're including vitamin C-rich foods, because it helps that iron to absorb. So vitamin C and iron go together, all right? Let's just flip right over to the next question, which is kind of similar to that, which had to do with vitamin D. Okay. Wait a minute, before I even go on here, I'm going to I see Lisa. Lisa is, she's borderline anemic this pregnancy, and it's your first. Can I address that for a minute? I'm going to just stop, because I want to say that borderline anemic is actually a normal state for pregnancy. Now, many of you are watching this live Q&A tonight, and you're hearing all about breastfeeding, and I'm an IBCLC, but for many of you who are first timers here or have only just started following me, you may not realize that the majority of my career I spent as a labor and delivery nurse and a nurse midwife, taking care of pregnant moms through their pregnancy and delivering babies. Okay, so I just want to talk for a minute about your iron levels, because we're going to talk about vitamin D as well. But when you are pregnant, it is normal for to be borderline anemic, and actually it's healthy. What I mean by that is somewhere around 24 to 28 weeks of pregnancy, your blood will actually thin out, okay, it becomes dilute. That means that it's increasing blood volume. Blood volume increases by about 50% halfway through the pregnancy, and this is a good thing. We want to see this happen, because that is how you can have a blood loss at delivery and still be fine, where the average normal person wouldn't be fine from that blood loss. So we want to see your blood starting to increase in volume. As that volume increases, the blood becomes more dilute. That means that it may look anemic. It may look anemic because it's more dilute, but that's actually a sign that your body is responding in the right way. And sometimes you can have some symptoms where you'll feel some, shortness of breath when you're going through this transition. Shortness of breath, some tiredness, all, again, normal signs. You obviously always want to talk to your doctor, talk to your midwife about it. But this borderline anemia, unless it's really severe, you don't want to start taking all kinds of extra supplementation or iron, because you will get very constipated, which is not fun when you're pregnant. And we want to see that, what we call physiological anemia. It's a normal state, okay? A normal state. I got a little sidetracked, but I couldn't help it. I saw that question, and I had to answer it. There you go. Okay. Vitamin D. You're very interested in vitamin D. Let's do vitamin D. Let's make this the last question of the night on vitamin D. All right. Vitamin D. What is vitamin D, and do babies need it when they're breastfeeding? Yes. Thank you for the hearts. Lots and lots of hearts. We have hearts for that one. Vitamin D is actually not a vitamin. It's a hormone. It is something that our body produces, okay, actually in the skin, in response to sun exposure. And so when you sit in the sun, your body will produce vitamin D on your skin. And vitamin D is important for all the body's functions. It's really important during pregnancy. There's all kinds of studies now being done of just how important this is during your pregnancy, for the baby, for you, and then throughout your whole life, and cancer prevention and wellness and, flu prevent, all kinds of things. So you want to make sure that your vitamin D levels are normal. And most people are severely deficient in vitamin D because we just don't get the sun exposure that we need, and we're using all kinds of sunscreens when we do, or we live in colder climates and we're really not outside enough. And the darker your skin, for African Americans, for darker skinned people, they're going to really have issues with vitamin D because their bodies don't absorb it even more. So you want to make sure that you're getting your vitamin D tested, okay? And that ideally you want your vitamin D levels to be above 50, which is pretty high. And that's where we see that we have the most optimal health, is when the levels are over 50, okay? Now, can you get this from your food? Not really, okay? You can't really get enough vitamin D just from eating it. It has to come from the sun, or it has to come from supplementation. So that means you're going to be taking vitamin D supplements if you're not getting enough sun exposure, all right? And usually the supplementation that you need is a lot higher than what you read or what the USDA recommended daily allowance is. They talk about minute amounts. 400 units a day is nothing. You need 4,000, 6,000 units a day to get your levels up to where they need to be, which is over 50, like I talked about. Now, does your baby need vitamin D supplementation? Yes, okay, babies do need vitamin D. How do they get vitamin D? Two ways. They either get it from sun exposure themselves, which we're not going to be exposing little babies to a lot of sunlight, okay, unless you're going to be outside with them, and sometimes that's enough to get sunlight on them. You don't have to, it could just be their face and their hands exposed to get sun exposure, and the rest will need to come through their diet, through your breast milk, okay? So as long as you are supplemented and your levels are high enough, your baby doesn't need extra supplementation. Okay, let me get that straight. So if your levels are too low, your baby may need to have extra supplements of vitamin D. But if you keep your levels optimum, then your baby doesn't need extra vitamin D. They're getting what they need through your breast milk. Okay, through your breast milk. One recent study, I think it was like just maybe 2 years ago, showed that by taking about 6,400 units a day, when a mom takes about 6,000 units a day, then their baby required no extra vitamin D. Okay. Now just remember, vitamin D is a fat soluble vitamin, and what that means is you don't pee it out. You can take too much. So you want to do this with your doctor. You want to be testing your blood. Make sure that your vitamin D levels are normal. I'm going through this myself right now. We all need to keep our vitamin D levels good, and just had a blood test done to check mine. Was a little bit low, increasing right now. So it's really important to keep an eye on that and keep yourself healthy and getting enough vitamin D. And remember, when you're in the sun, this is a big mistake a lot of people make. When you do go in the sun, because now it's summertime, so a lot of us are outside. We're like, okay, we're getting enough just from the sun exposure. If you sit out in the sun and your body starts to produce vitamin D in the skin, and then you come inside and you take a nice shower and soap yourself up, you just washed away all that vitamin D. So that's a big mistake that a lot of people make, is that they take a shower after they've been in the sun. You're at the beach, you're at the pool, you're like, okay, I need a shower. Here's what I would recommend. If you've been in the sun and you're trying to increase your vitamin D levels, which everybody should be, then you don't want to use soap all over your body. Just the important parts, okay? That's all you need, soap there. And then everywhere else, just water. Just water, because the water's not going to rinse away the vitamin D in your skin, and that way you'll get all the benefits of being out in that nice sunlight. Okay, so there's your tip of the week. for vitamin D, not washing it away. All right, guys, listen, we didn't get through all the questions tonight, but I tried my best, all right? We still have a bunch more, but I'm going to save them, and we're going to come back and do another Q&A. It is a little bit after 10. We went for a long time tonight. I want to thank our sponsors, Rachel from Rachel's Remedy and Kelly and Patrick from Lacta. Everybody give them lots and lots of love and hearts. Go over to their page and tell them how appreciative that you are that we get to do this because of them and also the amazing prizes they're going to give away. Make sure you like or love this post tonight, and that you commented here telling me what you loved about it. And, you know, to all the new people, welcome, and to all the people who've been following, thanks for coming back. This is my favorite thing to do, is to spend time with all of you guys. And we'll be back Wednesday night. So we got 2 amazing shows this week. Just 48 hours from now, we're going to be talking all about potty training on Wednesday night. Who's coming to the potty training show? You guys might be not into that right now. You're breastfeeding. Maybe you are. Maybe you're potty training and breastfeeding. But we're going to be doing potty training this Wednesday night with my guest, Tammy Gold, and Naturepedic. So I hope I will see you then. If you haven't RSVP'd and you want to get reminders about any of these upcoming shows, which we're going to have a lot of really good ones coming up in the next few weeks and months, always look at my events calendar and you can RSVP so that you get a reminder, okay? I am so happy to spend time with you guys. I love you all. Have a wonderful, wonderful night. Mwah. Big kisses to you all. See you on Wednesday. Have a good night, everyone.